Ryan Reynolds here from Mint Mobile. I don't know if you knew this, but anyone can get the same premium wireless for $15 a month plan that I've been enjoying. It's not just for celebrities. So do like I did and have one of your assistants switch you to Mint Mobile today. I'm told it's super easy to do at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan, equivalent to $15 per month required. Intro rate first 3 months only, then full price plan options available. Taxes and fees extra. See full terms at mintmobile.com.
Have I Got News for You is back for another season. Roy Wood Jr., Amber Ruffin, and Michael Ian Black are finding the funny in the week's biggest stories. Have I Got News for You, Saturday at 9 on CNN, and stream next day on Max.
Health alert as cases of the measles continue to spread here in Texas.
The Texas Department of
Over the last few weeks, a small community in West Texas, just on the border with New Mexico, has been grappling with a public health crisis. A cluster of measles spreading from an isolated Mennonite community outwards.
This mother and her 8 children, some of whom were coughing and had a fever, got tested this week at a mobile site in the outbreak's epicenter, Gaines County.
This started as 2 cases in Gaines County, and unsurprisingly, in a short amount of time, it's now 48.
Dr. Adam Ratner is an infectious disease specialist who just happens to have written a whole book about measles. It's called Booster Shots.
That is alarming. And I know that it sounds like a small number of cases, but it's really not. Measles is the most contagious disease that we know. I would not be surprised to see those case numbers go up significantly in the coming days.
Dr. Ratner was right about that. Almost as soon as we got off the phone, Texas health officials announced that 10 more people had been diagnosed. Most were unvaccinated, kicking off a frantic race to protect people. I got a sense of how difficult it might be to communicate about this outbreak in Gaines County when I logged onto the Facebook page for the local hospital that's trying to get in front of this outbreak. They're doing like drive-through clinics, things like that, to just get shots in arms. And a lot of the comments on this Facebook page were just infused with misinformation. People saying stuff like telling people to have their kids vaccinated instead of letting parents make that choice sounds like the blind giving advice to the seeing. And people saying stuff like, please do your research before getting vaccinated because adverse reactions are severe. People posting Tucker Carlson videos where he talks about having a kid who's quote unquote vaccine injured, whatever that means to him. Does that surprise you?
It certainly upsets me. It sadly does not surprise me anymore. For a very long time, people got their children vaccinated. This was not controversial.
You know, since 2000, measles has been considered eliminated in the U.S. Do you think in a few years it still will be?
I'm worried about our elimination status. If you have a vaccinated child in a well-vaccinated family, in a well-vaccinated community, the absolute risk to that individual child is low. But measles outbreaks are really important to pay attention to. They are a warning light that there are places in the country where the public health system is faltering. We're not getting vaccine to people who need vaccine, and they're about much more than just measles.
Today on the show, why a measles outbreak in Texas is bigger than you might think it is. I'm Mary Harris. You're listening to What Next? Stick around. This episode is brought to you by Discover. Have you heard about Doublenomics? It's okay if you haven't. It is extremely niche and practiced by Discover. Here's an example of Doublenomics. Discover automatically doubles the cash back earned on your credit card at the end of your first year with Cashback Match. That means with Discover, you could turn $150 cash back into $300. It pays to Discover. See terms at discover.com/creditcard. This podcast is brought to you by Progressive Insurance. Do you ever think about switching insurance companies to see if you could save some cash? Progressive makes it easy. Just drop in some details about yourself and see if you're eligible to save money when you bundle your home and auto policies. This process only takes minutes, and it could mean hundreds more in your pocket. Visit Progressive.com after this episode to see if you could save. Progressive Casualty Insurance Company and Affiliates. Potential savings will vary. Not available in all states. Dr. Adam Ratner has been working specifically on pediatric infectious diseases for more than 2 decades. He's seen kids sick with all kinds of things, but he was pretty surprised to watch measles roar back the way it has over the last decade.
As I came through as a young doctor and then a more senior doctor, I thought of measles as kind of a solved problem, like something that, we saw occasional travel-associated cases. I knew it was still a major cause of childhood mortality worldwide, but it wasn't something I dealt with on a day-to-day basis.
Did that change at some point?
Yeah, and then in 2018 and 2019, I was working in hospitals in New York City, and we went from seeing measles not at all to taking care of multiple kids with measles every single day during that outbreak.
And to give some perspective, Mayor de Blasio said in 2017, there were only 2 measles cases in New York City. There are now nearly 300.
And it was frustrating because these were children who were miserable. They were sick. Some of them required intensive care units and ventilators and, our highest levels of support. And it was entirely preventable.
Correct me if I'm wrong, but the outbreak in New York in 2018, 2019, this was also like what's happening in Texas now, a religious community, right, that was not as vaccinated?
Yeah, so what happened in New York City was if you had looked at the vaccination rate of New York City as a whole, like the kindergarten vaccination rate for MMR, it was somewhere around 97, 98%.
Seems pretty good.
Yeah, it's well over the 95% threshold that we use. So if I had looked at the beginning of 2018 at those rates, I would have skipped right over New York City and said, okay, they're good. The problem was that those rates, which were either statewide or citywide rates, don't have the granularity that you need to find these pockets of under-immunization. And so there were communities, sometimes small communities, that had much, much lower vaccination rates. And there were travel-associated cases that came into those communities, and then measles was able to take off because even if the city as a whole had a 98% vaccination rate, once it's into a community that has a 70 or an 80% vaccination rate, which is what we saw in Brooklyn and it's what we're seeing now in Gaines County, measles can spread from person to person to person and keep going.
You've pointed to this one outbreak in particular that illustrates just how effective the MMR, the measles vaccine, has been. This is an outbreak in 1970, which was right after the vaccine became widely used. Can you explain what happened in Texarkana?
Sure. So Texarkana is a city that straddles the Texas-Arkansas border, and part of the city is in Texas and part is in Arkansas. And in 1970, the two states had very different vaccination policies. One had a vaccine mandate for going into kindergarten. The other did not. And what we saw was that even though about 2/3 of the population of Texarkana lived on the Texas side where there wasn't a vaccine mandate, and 1/3 lived on the Arkansas side. So you would expect once there was a measles outbreak that about 2/3 of the cases would be in Texas and 1/3 of the cases would be in Arkansas. And that's not what we saw at all. What we saw was that about 95% of the cases were on the Texas side, and very, very few cases were on the Arkansas side. And so what that meant was that these policy decisions, the decision to use vaccine mandates, the decision to support vaccination at the governmental level, made a direct difference in the health of the children of Texarkana.
And just remind me, before the MMR vaccine, what was it like to get measles? Because measles was expected, right, when you were a kid?
Yeah, so before there was a vaccine against measles, meaning anytime before 1963, about 100% of people got measles in childhood. So we're talking about millions of cases in the United States every year. For most children, it was, a week or so of fever, rash, discomfort, very red eyes, pain when looking at light, things like that. And then they got better. There were the more rare effects of measles. You had about 1 in 1,000 children who would develop encephalitis, so that's swelling of the brain, and that can lead to deafness. It can lead to seizure disorders. About 1 in 1,000 would die, which, when you scale that to an entire population, is a lot of deaths every year from measles in the United States. And somewhere around 1 in 5,000 to 1 in 10,000 would go on to develop SSPE, which is subacute sclerosing panencephalitis. It's a degenerative neurological disease that starts about 7 years after measles infection. The vaccine protects against it, but again, that's a small number of kids. But these were kids who were devastated and who would die from SSPE, and that's something that essentially doesn't happen in the U.S. anymore.
So it was 2000 when the U.S. was able to declare measles eliminated, but I've noticed these little measles clusters popping up again and again in the last decade or so. One outbreak in 2014 and 2015 was traced back to Disneyland. What did we learn about the state of vaccination in the U.S. from that outbreak in particular?
What we saw in California was, that there was an outbreak that was based at Disneyland, that both, kids around the area of the park and also park employees and others were developing measles, but that there were places in California, there were schools in California that had exemption rates of more than 50% in their kindergarten classes. And so you had these pockets where there were large numbers of unvaccinated kids, and measles was able to spread from person to person to person.
50% is so high. Half of people just opting out.
Yeah, it was alarming. And again, when you looked at the state as a whole, the vaccination level appeared fine, but you had these clustering of exemptions, clustering of unvaccinated people in communities, and that is a recipe for measles outbreaks. And I think for a lot of us, the Disneyland outbreak really unmasked that.
How did the state of California respond to this outbreak, especially the legislature?
There was outrage about the outbreak. There was a lot of pro-vaccine press afterwards. There was a lot of anger at people who had opted out of vaccination for non-medical reasons. And State Senator Richard Pan, who is a pediatrician, put forth legislation to eliminate what are called non-medical exemptions from California schools.
How did it change what happened in California?
The bill got passed with a lot of controversy and a lot of people fighting back against it. And a couple of things happened. So I think, not surprisingly, the number of exemptions overall went down when there could be no new non-medical exemptions. Vaccination rates in general went up. But what we saw happening was that the number of medical exemptions then went up and clustered in much the same way that we saw the non-medical exemptions clustering prior to that bill.
So people just found a doctor who would opt them out.
That is what happened. And so there were other legislative interventions where they made it harder for doctors to do that. Doctors were able to provide medical exemptions, but more documentation was required. And if a doctor had, was giving a large number of exemptions, that would be looked at by the health department. There were a bunch of interventions, but it was still a problem.
So I want to talk about how all this came together in Texas this winter. I've read that in the 2023-2024 school year, twice the number of kids in Texas have a vaccine exemption than they did a decade ago, which is pretty wild. There are 13,000 kids with vaccine exemptions. It just seems like a recipe for a spread, which is what we're seeing happen.
Absolutely. So I think what we've seen nationwide, starting even before COVID, but really thrown into higher gear by COVID, is more people opting out of routine vaccinations. Exemptions are rising. You mentioned Texas, where more than 2% of kids are opting out of vaccines, and that's been reflected nationwide also, where we have much higher rates of non-medical exemptions for vaccines than we used to.
After the break, Dr. Ratner talks about the questions he gets from parents of hospitalized kids with vaccine-preventable diseases.
Have you ever spotted McDonald's hot, crispy fries right as they're being scooped into the carton? And time just stands still. Ba-da-ba-ba-ba.
This President's Day, upgrade the look of your home without breaking your budget. Save up to 50% site-wide on new window treatments at Blinds.com. Blinds.com makes it easy with free virtual consultations on your schedule and samples delivered to your door fast and free. With over 25 million windows covered and a 100% satisfaction guarantee, you can count on Blinds.com to deliver results you'll love. Shop Blinds.com's President's Day mega sale now for up to 50% off site-wide. Blinds.com. Rules and restrictions may apply.
Build a routine with Ollie that supports your wellness needs, like getting your daily vitamins and minerals with Ollie's multi-gummies, or keeping your mood upbeat with all the vitamin D in Hello Happy. Give your gut health some support with probiotics, and wake up feeling refreshed after taking Ollie Sleep. Do wellness on your terms. Find Ollie at a Walmart or Target near you or at ollie.com. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
I feel like hanging over our whole conversation is the fact that one of the most prominent anti-vaccine advocates, RFK Jr., was just confirmed by the Senate to be our Secretary of Health and Human Services. I want to talk about that because you've actually singled out these federal programs that keep people well and vaccinated, even if they're in a community that maybe doesn't have as many resources. And I think some are worried that programs like that are under threat now. Is that a concern you share?
Absolutely. I mean, that is the major message, I think, of my book, which is that we have made incredible progress in protecting children against diseases, making childhood safer over the last century. And none of that is guaranteed. That is a system that requires continued vigilance, continued policy interventions, continued investment in order to keep providing those benefits to kids. I think that in the current administration, and we're seeing the destruction that's going on of federal programs now, things like the Vaccines for Children program, the CDC Advisory Committee, ACIP, which helps guide vaccine policy in the United States, all of these things are at risk. And I think that puts us at risk of being a substantially less healthy population in the coming years, and I'm talking about in the short term, than we are now.
I mean, you talked about how you worked as a clinician and saw all of a sudden measles reappear, and you weren't expecting it necessarily. I wonder if you would speak as a clinician to parents and other physicians about what to look out for in the next few months and years as you expect the landscape to be a little bit harder to comprehend and for unexpected things to happen.
Yeah, I think that there is a tremendous amount of bad information out there. And I think that there's this idea being pushed that vaccines aren't needed because they protect us against things that aren't really dangerous, like measles. And I think for parents who grew up in a time after the measles vaccine was available, after the polio vaccine was available, I think that there is a lack of direct experience with these infections that makes it easy to say, well, I've never known someone who has died of measles. I've never known someone who had a lifelong disability as the result of polio. But those are real things. And even though it may not be apparent in your family immediately, this is something that can change quickly.
Is there a parent or child from back in 2018 who you're still in touch with, whose story still strikes you, who maybe expressed to you as an individual some of these things you're talking about more globally? Like, oh, I thought this would be fine, but it's not.
I've seen parents who've had children who were sick with vaccine-preventable illnesses. Measles is one, but there have been others where during the period where their child was in the hospital and very sick, who have said, well, can we give the vaccine now? And of course, vaccines don't work when kids are sick. They work to prevent illness. And I think that what it points to is that we don't, as a society, communicate the value of prevention as much as we could.
Yeah. I think some people might hear your story of Texarkana and feel safe. Like some of my listeners may feel like, well, I vaccinated my kid and I live in a non-rural blue city. So what's happening in other places may not impact me. I wonder what you would say to a family who may be hearing about this measles outbreak and unvaccinated families and think, hopefully this won't be a problem for me.
So we vaccinate everyone we can, in part to protect the people who are getting vaccinated, and in part to protect the people around them who maybe are one of the couple of percent of people who may not respond to the measles vaccine, or maybe we're thinking of a kid who is too young to have gotten the measles vaccine. We give the first dose at about a year of age, and so kids under a year are at higher risk. Or maybe it's the kid who's getting chemotherapy and can't get the measles vaccine. There are all of these people around us who need that protection also. And so that's why we try to vaccinate everyone in the community. The measles vaccine works extremely well, and we have used it to control the spread of measles within the United States, within whole continents. And if we were to put our minds to it, we could probably eradicate measles from the world the way that we did with smallpox. So the incredible contagious ability of measles and the fact that we can prevent it with a vaccine make it sort of an ideal warning sign as an indicator that there's something going on with vaccine rates, with trust in public health, because unsurprisingly, when vaccination rates start to fall, measles is the first sign. It will be followed by other vaccine-preventable diseases, but because it's so contagious, we see measles first.
What kind of other diseases would come next?
So things that I'm worried about, other vaccine-preventable diseases that are really frightening are pertussis, which is whooping cough. We had the largest number of whooping cough deaths in the United States last year that we have in more than a decade. There are other vaccine-preventable diseases that I hope do not return: polio, diphtheria. We have vaccines that prevent many bacteria that cause sepsis and meningitis in children. There is one called HIV, that used to be a major cause of sepsis and meningitis in young children that was essentially wiped out from the United States, where we're starting to see pockets of HIV disease as well. So as vaccine rates drop, we're going to see more of all of these. And the problem with it is that, each of these kids that gets sick, each kid that dies of a vaccine-preventable disease, that's a real child, and that's a preventable death.
Dr. Ratner, thanks so much for coming on the show. I'm grateful for your time and your research.
Thank you. It was wonderful being here.
Dr. Adam Ratner is a pediatrician of infectious disease in New York City. He's also the author of Booster Shots, The Urgent Lessons of Measles and the Uncertain Future of Children's Health. And that's our show. If you are looking for another Great Slate podcast, allow me to recommend one. You should go listen to this week's episode of Culture Gabfest. Hosts Steve and Dana talk to Slate's Nitish Pawa, you know him, you love him, about two must-watches, Severance and the Oscar-nominated film No Other Land. All right, What Next is produced by Paige Osburn, Elena Schwartz, Rob Gunther, Anna Phillips, Madeline Ducharme, and Ethan Oberman. Ben Richmond is the Senior Director of Podcast Operations here at Slate, and I'm Mary Harris. Go track me down on Blue Sky. I'm at Mary Harris. Thanks for listening. I'll catch you back here tomorrow.